Hi, I'm Jeremy Crosby.
And I'm Nick Boucher. We're the hosts for the program that's all about your city, Talking Fitchburg.
Every day, we pull together the news, events, and information you need to stay on top of what's happening in the city of Fitchburg.
Find Talking Fitchburg on cable TV, Roku, Amazon Fire, Apple TV, and our live stream on the web. Plus, you can view all our headlines and stories on Facebook, YouTube, and our video on demand service. This is your city.
Keep up with Talking Fitchburg and the issues that affect you and your neighbors.
Want to know what's happening in your city? Get Notify Me messages from the City of Fitchburg. Visit fitchburgwi.gov on your computer or mobile device and select the big Notify Me button on the left. Enter your email and/or phone number, whichever is best for you to get notifications. Scroll down the list and select all the topics you're interested in to receive email or text messages about. You'll be notified every time one of your topics is updated. Sign up for Notify Me, one more way to keep up with your Fitchburg government.
Good evening. I'd like to welcome and thank you all for attending the 2024 annual district meeting for Fitch-Rona EMS. For the attendees in the audience, if you don't mind, we'll do just a quick self-intro. So we can maybe go far left or far right.
I'm Tucker Long, council member from City of Verona.
Hi, I'm Mark Geller. I'm the town chair for Town of Verona.
I'm Tom Mathias, town supervisor at Town of Verona.
I'm Brandon Braithwaite, councilman at City of Verona.
Thank you very much. And when Michelle gets a chance, she'll hand around a sign-up sheet for. Also, just there'll be for sure one voting topic. So it'll be approval of the minutes. Just so the parliamentary process is the district. Members aren't voting unless they're representing the city. So each municipality gets one vote. So when it comes time, so it might be a little clunky, but somebody from the town will vote, represent the town, that sort of thing. All right. Roll call for the commission then.
Roberts.
Here.
Hilla.
Here.
Lonsdorf.
Here.
Paul.
Here.
Lytle.
Here.
Kaiser McHenry. Johnson.
Here.
Wheeler.
Here.
Luganbuehl.
Here.
Anderson.
Here.
Dostalek.
I'm here.
Great. It's clear to me now I've got my agenda a little out of order. Then the welcome came first. But so we're moving to the review and approval of the 2023 annual meeting minutes. They were provided as in the packet in preparation.
I don't know if you want to do any public comment. I don't know if Mark.
Oh, I'm missing up. I'm jumping all over the place. Is there any public comment? Thank you. No public comment. Now moving to review and approval of the 2023 annual meeting minutes. Is there any questions, comments, suggested edits to those minutes? Seeing none, then I need a motion from one of the municipality representatives to approve the meeting minutes.
I wasn't at the meeting last year, but I'll move approval of the minutes.
Okay. Is there a second to approve the minutes?
I'll second.
Oh, okay. Oh, we can. Oh, yeah. One of the one of the commission members who's a elected official.
Well, you can because the town already did.
Yeah. Somebody else can.
Jim can.
Okay, so Jim Wheeler.
Jim did.
Thank you. I told you it was going to be clunky. All right, so we have a motion and a second. All in favor from the municipalities, elected officials signify by saying aye.
Aye.
Is there anyone opposed?
I abstain. I was not here last year.
Thank you. Anything else? Then the minutes are approved from the 2023 annual meeting. Next agenda item is presentation of the 2024 length of service.
Sure. So we started doing this a handful of years ago, kind of when our employees hit the 5-year anniversary marks of recognizing them publicly. We have certificates, and then they actually get a pin as well. I know a lot of these people had prior commitments tonight, so they were unable to attend, but wanted to recognize Lieutenant Christy Schnabel. This will be her 15th year with Fitch-Rona. And then this is actually the 5-year anniversary year of opening up that station number 3 when we brought on those 7 new paramedics in 2019. I think they started in. So Nicole Newton, Catherine Cat Floyd, and Justin Mitmoen. So they have all celebrated their 5-year anniversary this year as part of that group that started with the opening of that new station. So congratulations to them, recognizing them for their years of service.
Thank you. Next up is the Chief's report.
If you don't mind. So if you don't mind, I'm going to get up and walk around just because it's easier to... It's what I do. So this did get emailed out in the packet for everyone. So I'll talk a little bit about what's included in that Chief's report. Oops, that's right. I forgot to fix last year. It automatically starts cycling and forget. It just moves the process along a little bit. So this is actually a year ago's photo. About every 2 years, we try to take a photo of our employees staring into the sun. But this is just an updated roster. We're currently at about 45 full-time, part-time interns and support staff. So here's the numbers updated for us this year based on the population, and this would have been the population based on the clerks from about a couple of months ago when I put in for our state funding. So we're up to about 48,000, right? That's all through municipalities. If we break that down to, we'll talk about that budget process, but if we remove what we anticipate getting in run volume in our contracted events, what gets left to be paid for by the municipalities, divide that population in there. The cost per capita for our district is about $44.64, about up $4 from last year. I do share the county does this as well. They don't get a huge participation in that, but the county actually does an annual survey as well to all EMS agencies. We're pretty much smack dab in the middle with most of the other agencies in Dane County. There's some of them that are significantly smaller, still largely volunteer services, and there's a handful of much smaller municipalities that, like statewide, are struggling to keep those ambulances in service and have some career staff that are up in some of the hundreds of dollars. So every one of our citizens paying $44.64 for the services they get. That's an estimate. I think about a couple of years ago, we added in the town of Madison area. So we cover about 71 square miles. Just to review, we have 3 full-time paramedic ambulances running 24/7. The district owns 5 ambulances. 3 of those are in service at all time. 2 of those are rotated through when there's some maintenance stuff. We have 2 support vehicles. So it's the C up there is for car 15, car 17. Primarily Deputy Chief Dostalik runs car 17 out of station number 3 on South Sain Road. I'm down in car 15 down in Verona. We use those vehicles. I said largely I call it the UPS part of my day, where I run supplies and equipment and stop at all the stations and manage those. But we do actually respond to calls as well as an additional provider, an extra set of hands. And a handful of years ago, we got a donated trailer that the county emergency management wasn't using anymore. We turned that into a rehab trailer. So what we use that for primarily is fire response and for special events. So before we had that trailer, each one of our stations had a stash of water. We had some chairs, some snacks, some cooling towels, right? Kind of everything, because you never really knew where that fire was going to be. That all now lives in one trailer in Verona. So on the case of a structure fire, or the last week when we were actually out at the World Dairy Expo at the Alliant Energy Center, we just take that trailer with us. There's a pop-up tent. There's about 5 cooling chairs, again, water, nutrition, cooling fan, flares, a bunch of equipment, all in one place, which has been very, very helpful. As actually, I actually probably think it's actually been to outside of our own district to help other area fire services, probably more than we do in our own district. So we use that to help out our neighbors as well. Deer Grove, once we got ours, Deer Grove, there was a fire out in Deerfield, so Deerfield Fire requested it, Deer Grove EMS requested it. That was actually its first deployment. They were so impressed with it, they did the same thing. So now there's actually one on the east side of the county as well. We kind of support the west side of the county with that. There's a UTV up there as well. We got that with Flex grant from the county a couple of years ago. It's an electric UTV. Again, predominantly used for our supporting of events at the Alliant Energy Center. We use it as well for our cross-country meets out at the Fitch-Rona High School. We follow the crews around, as well as we use it out at Epic. So makes us a little bit more mobile. Zoom in, that kind of whitewashed it out there. So that is a picture of our district as a whole. You can see where our municipalities are. Those red, the red stars up there, those are where our 3 stations are. This is what our staff looks like. I mentioned we're up to about 45 people, give or take. So we have 21 full-time paramedics, 2 administrative staff. That's myself and Deputy Chief Dostalik. We are licensed paramedics as well. Jeff runs with some other services, so he's probably a better field provider. I say I make a really good partner for our staff. By the shout outs every month, I don't want Michelle to go unrecognized, though she's our part-time office manager and a world of help and a wealth of information for us. So she's sitting here, so thank you very much for Michelle and the work that you do, because it's phenomenal. Anywhere between about 12 to 18 part-time paramedics. We call them LTEs. There's some contractual language with that. So limited term paramedics, they pick up our vacation and sick time. We have 3 EMTs who are also just part-time with us as well. They primarily do, they don't run on our ambulance, but they do special events for us. So they'll go out to the Alliant Energy Center. They'll help with cross-country meets, again, they're special events. We do have 2 EMS interns. We met one tonight, Katarina Tao. She's actually our new one who is just starting this year. She just graduated high school. So she's got that first responder. She's an EMT this fall. Molly Jesberger is her mentor. So she works up to 3 to 4 days a month with Molly and her partner Chance and all the other ones who work with her. So she's at MATC her first year now, going through the EMT class as well as doing her general education requirements. Next year she will go to paramedic school. And then last year we swore in Ava, who is finished her first year last year, and she's actually enrolled in the paramedic class this fall. And then we have Tom Bates. We recognize him every year, a volunteer paramedic. He's been with us for just about 35 years. Still runs about every other Sunday from 11 to 5. He hops on a shift somewhere and helps out those crews. So he's not quite ready. I think last time I talked to him, he said, one more cycle, one more licensure cycle, but he's been saying that for about 4 cycles now. So he's still around and still helping out. So this is the chief's report that gets presented every month to the EMS commission, gets mailed out or gets emailed out to the clerks that I'm hoping they're passing on to the council members, that we just look at compared to the last 2 years. So you can see where we're at this year to date. We're at 5.5% above where we were last year. If you look at that going forward, that would hit us at about 5,127 calls for the end of the year. When we work on budgets, and we'll talk about that when we get to the budgets, we anticipate the 43-year average of Fitch-Rona since 1977. We average about a 3% increase a year. So this is where we see right the average of probably 5% this year. A handful of years ago, it was down about 6%. We average about 3% per year, but this is where we're at. As you can see from some of those numbers, even just within about the last 12 months, we're starting to hit some of those 400 calls per month. I think even this year, about 3 months ago, 469, 464. This year alone, we've hit a couple of record months. I do like to point out, this is calls for service. That's not always a patient contact. That just means the pager went off, right? It could be a motor vehicle crash. It could be a fire standby. It could be a police assist. It could be rescuing a horse. Jeff got to help go rescue a horse, right? So that just means the pager went off. So not all of those calls get billed. That's just the number of times we were paged out. It's entirely possible we were canceled before we left the apron, or we were gone for 6 hours. This morning we went and helped at if you saw the news, there was a fire out in Stoughton. Because of the size of that fire and because of our neighboring district, we actually sent an ambulance out there this morning to help with their rehab for the firefighters on that fire ground. And that happens a lot through the county. We just help each other out. Runs by municipality. This has been creeping up right over the last handful of years, but still has been fairly consistent. About 67 year to date. About 67% of the calls are in the city of Fitchburg, 26% in the city of Verona, about 3% in the town, and then roughly about 11-ish% that happen in our neighbors. This is what it looks like just by the month, right? The big blue line there, it's tiny print, I apologize. Hopefully you got it emailed to you. Right, the blue one up there, about 65% in Fitchburg, right? So a little less last month, a little higher for the city of Verona in red there. And then the two other little pieces, the green one is for the town of Verona, and the purple one is for those other municipalities. Again, like I mentioned, going out to Stoughton, those are the others. Numbers that we look at, again, these are things I report every month. So these are things we look at, or how fast are we getting out the door, and how fast are we getting on scene. So we try to get out the door within about 90 seconds, right in the middle of the day. Very acceptable. At night, as you can imagine, it's a little more challenging, right? The Verona Fire Station has 2 stories, right? So they got to get up. Pager goes off, getting up, grabbing your boots, trying not to fall down a flight of stairs, get down to that ambulance, get the garage door open, figure out where you're going, and answer up in the radio. So, right, that's why we see that fractal time there. Sometimes at night, it's just going to take us a little longer out to get out the door. During the day, we should be good. So our median time, and this is not seconds, it's minutes. So it's 1.42 minutes, so it's right under that 90-second mark. Other numbers we like to look at as we look at growth, right, is where we put stations. So en route to arrived on scenes, right? So there's those handful of factors. used to be able to, we changed the software that we use changed about a year ago, and I used to be able to factor out some of the weird things that would take us time, like if we get called to Mount Horeb, we get called to Stoughton, right? That's a significant response time. Used to be able to factor those out. We're actually very limited to that now, and I can't. But the numbers are still looking okay, right? So that median time, the median time for us to get to anywhere in our district is under 5 minutes, right? Not a bad response time. The National Fire Protection Agency, and this was kind of the driver of getting that Station 3 a handful of years ago, says that in a provider, not necessarily an ambulance, so this is our partnership with our fire departments, a provider should be there in less than 9 minutes. We're at 9.12 is our 90th percentile. Right, so we're just over kind of where that standard is. But until we want to build another station, that's where we're going to be. So I think right now we're meeting those standards. That on-scene to transporting time, this is something we look at with our medical director, right? This based on the acuity of our patient, we don't want to be on scene time for any more than 15, or on scene any more than about 15 minutes, right? Because if you can look, we're about 10 to 15 minutes from the hospital. So providing that patient care, stabilizing that patient, and then getting them to the hospital. So our median time, we're sitting on scene about 15 minutes-ish. 90th percentile meets up to that 26 minutes, right? As I mentioned, the biggest reason I use the fractal times is because it does like to throw out those outliers of sitting in the Stoughton fire for 6 hours, or that canceled on scene, or that canceled out the just drove out to the patio and backed in, about 15-second call. So it gets rid of those, but there's times where patient contacts, right, they're complicated. All right, so we're doing our best we can to stay on scene and work through to get the patient kind of the best outcome. So sometimes they do stretch out to a bit of time. That transporting to destination, an uncontrollable number, right? It's geography getting from a patient's house to that hospital. We have, a train, I think, in the city of Fitchburg. It runs twice a week at 2 p.m. and hauls rocks or something like that, right? But that's the best example I can give you of the non-controllable factors, right? With construction, how long does it take us to get to the hospital? Not a huge manageable number. Statistically, even if you got questions about transporting lights and sirens, even statistically, lights and sirens do not make a huge statistical impact in transporting patients. Whole nother conversation if you're interested in talking about it. And then once we get there, right, how fast are they getting in there, turning that patient care over, cleaning up the cot, and getting back to service? All in all, right, the average time our ambulances are out of service from the time they get called to the time they clear, and that return to in-service, that means they clicked the little button on the radio, or they clicked it on the computer, called in the radio. That puts them back in service. That doesn't mean they're back in district, right? That just means they're leaving the UW Hospital, Merritt, or St. Mary's, whatever it is. They're available for calls. Occasionally they do get called back to the district, right? Kind of depending on the nature of the call. All of that, each ambulance or each call is a little over an hour. It's about an hour and 15 minutes when an ambulance is out of service. So that takes us to a number I'll talk about in a little bit. This is the map I really do like to show, right? This is it's a heat map, right? So this actually is pulled from state data. All of our information is sent to our billing company, which sends it up to the state. So within the last 12 months, you can see those big red lines, those big red areas. That's where most of our calls are. So it doesn't differentiate what type of call, it's just mere calls. So I could use a pointer, but there's so many ones to look at, right? So up in the right-hand corner there for your map, just kind of your orientation, that's the belt line up in the top right-hand corner. The red line that goes down the right side of the screen, that is Highway 14. Right in the middle there, as it kind of cuts off to your left, that's 151 wrapping around the south side of Verona and heading west. So you can see the majority of our calls in Fitchburg come right down that Fish Hatchery Road corridor, right? And then right towards the bottom there, kind of the big blob at the bottom, that's kind of the Chapel Valley area. Again, as you can suspect, largely it's our senior population, as well as in that upper right-hand corner. That's that new acquisition with the town of Madison, new Fitchburg. And then if we head out to Verona there, you can see the big red dot towards the top. That is North Edge Trail. What are the other streets over there? North Edge Trail. Yeah, I was trying to stay away from facility names. Enterprise Drive, North Edge Trail. Yes. And then kind of the smattering of right in the middle of Verona there is where that little yellow population is. So those are the majority of our calls are. As you can see, there's a little blue and green out there as well. We do get calls out in the district. Anything, I think right down that blue in the bottom right-hand corner, that's Oak Hill. Just data that I share every month, right? Calls by day of the week, it's fairly consistent. The red line that goes down the middle is our median for the year, and then the blue line is what it just was last month. So it's pretty consistent, as you can imagine. It's pretty high on Mondays when nobody wants to go back to work. That's just my assumption. And then here's our calls by hour of the day. I do like to highlight that middle part here. Again, the red line in the middle there is our median. The purple line is just what we did last month. It's fairly consistent, but like looking at that median. As we talk about expansion, right, as we need more ambulances, industry standard-ish is not scientifically based whatsoever, is about 1,000 to 1,500 calls per ambulance. So as you can see, we're getting up to about 5,000 calls this year. It's really time, as I've mentioned the last couple of years, we need to start looking at adding additional staffing in here to make sure we're covering our calls. I don't necessarily need a 24-hour ambulance, right? As you can look in there at 2 o'clock in the morning, 3 o'clock in the morning, we're covering our calls. What we need is right there, right? Between about 9 a.m. and 9 p.m., that is really where we need that additional staffing. So again, as we look into the future, as opposed to having to put an entire another ambulance with 7 new people, eventually we'll be there, right? But right now, additional staffing between 4 and 5 people will put another ambulance on the road during that time there. Something I just share every month, really, again, just informational. 70% of the top 70% of reasons why we are dispatched. I go with the reason we are dispatched, not necessarily what that provider impression was, because at the time we don't know, right? This is just what we're going to. So what the reason we get called for may not be the reason the actual is what's going on with our patient. As the commission has shared, if you're looking at the chief's reports I send out every month, sick person and falls just switch spots, right? And have been for about the last 7 years. And I'm sure before then it was the same. Big push. Deputy Chief Dostolik is working with the county and the state on fall prevention. So within the last month or two has actually gone out to a couple of facilities to talk about fall prevention. So really that's a big goal for next year is what can we do about false, right? It is the number 2 reason we're getting called. It's the number 1 or number 2 reason why we're getting called. How do we prevent that from happening? Sick person is a weird one because that's just kind of the catch-all. If you have a bleeding catheter, stubbed your toe, or vomiting, right? That's that generic sick person. Calls by number of the station. Station number 2, right? As you can imagine, smack dab in the middle of the district is 40%. These don't really change all that much either, right? It's about 40% in the middle there, 30% in Verona, 30% at Station 3. Biggest reason probably for that number at Station 2 is because that's, I don't want to call it the backup Verona because we are a district, but that's the ambulance. If there's a second call in Verona, it's going to Verona. If there's a second call in Fitchburg, it's going to Fitchburg, right? Our ambulances are truly based on geography, right? It looks at the district as a whole, right? I go back to that map. It looks at that. It looks at where those 3 ambulances are. We do have vehicle locators in all of our ambulances. Dispatch sends the closest ambulance in the district. Right, so the neighborhood over by McKee Road, like the Jamestown neighborhood in the city of Fitchburg, if that middle ambulance is out, it's actually closer for the Verona ambulance to go to Jamestown than it is for the ambulance from South Said to go to Jamestown. Right, so it's really truly based on geography. And as I talked about the potential for needing more ambulances in the future, to where those calls are happening, this is the number we look at here. Started looking at this last year and have gone back and tracing. So all the trucks are on calls, and I just go back for 1 month, right? I look back, and so there was 20 times in the month of September where all of our ambulances were out, right? Which means we had no more resources. Should another call come in, we would be unable to respond, and we'd have to depend on our neighbors. Right. Reality says I'd love to have an ambulance on the street corner of every neighborhood everywhere. It's just financially not going to happen. That's why we depend on our neighbors, right? That's how it works. And I don't separate it out by how long that was, right? So 20 times could have been a 1-minute overlap, right? All 3 of them could have been on calls for 1 minute. All 3 of them could have been on calls for hours. But it was 20 times this year, or last month. It was 17 times this month last year. The bigger number to kind of look at is that mutual aid required year to date. So that's 34 times. So as of the end of September, 34 times, right, as much as we kind of dodged the needing of an ambulance when all of our ambulances were on calls, 34 times we did not dodge that. So it was either the city of Madison, it is majority of the time it is the city of Madison, a couple times it's been Belleville, it can be Middleton as well, in usually, again, all paramedic ambulances in Dane County actually have a vehicle locator on them. If we are busy, the 911 center, that computer just finds the next closest ambulance wherever that might be. The vast majority of the time in Verona, it's McKenna Road, right? So you're getting the city of Madison out of McKenna Road, which is actually closer than South Said, based on the nature of the call. But so 34 times already this year, one of our neighbors have had to come in and cover our calls for us. Again, we are never going to cover our own calls 100% of the time. There are times of those 34, we've gotten 2 City of Madison rigs, right? Because it just happened to be, there was 5 calls in the district, right? Ideally, we'd love to be able to take care of our own calls. But 34 times this year was 42 times total last month. So do that quick math there. It's about 4 to 5 times a month where the city is coming in. Perspective-wise, before we put Station 3 in service, the city was coming in about 9 to 10 times a month. So we are still not where we were 5 years ago. We are still covering our calls better than we were before we put our 3rd station in there, but we're about halfway there. Here's our finances. Again, this is reported out every month, what that cash value is on hand. 2 times a year is when we get our municipal funds, back in January and in June, and then that number chips away over the course of municipal funds. We are constantly receiving run income in. So that number will go down every month, but we are, right, as kind of the unique nature of being an ambulance service, we bill for our services. So we do get funding in over the course of the year. What you see in there for especially our CDs, the CDs are where we kind of put that reserve funding we had talked about. Right, helps know that Patrick can't touch that, right? The reserve funding. Some of that savings account is grant funding. Some of it is state funding. There's a small part of that is a reserve funding as well. And then the WISC funds in there, that's the Wisconsin, look it up, Wisconsin Investment something. Yeah, I don't know. It's an investment group. It's actually a state cooperative investment group. We started investing with that about a handful of years ago, as I know the city of Fitchburg does. That is our post-retirement health care. So one of the advantages of our employees, once they retire based on state retirement criteria, whatever their sick time balance is paid out into a post-retirement health care fund for them. So that's where that funding comes from. FAP funding, that is the name for our state funding. We usually get an EPIC grant every year, and then the labor contract. Next year will be the year we will start our contract negotiations. That is just a bank, as opposed to having a spike every 3 to 4 years when we do contract negotiations. There's just a small amount that's put in that fund every year to kind of help keep the budget a little bit more balanced. When labor contracts is finished, that funding will come out of there, and then it will get filled up again over the next 3 years. So essentially, that's the chief's report that I present every month to the full commission, and then that's what gets shared with our municipalities. Any questions on the chief's report? Tom? Oh, I can repeat the question too. We're good.
Thanks. For the mutual aid, you look at how many calls out versus how many calls in, and just what's the trend on that?
Yes. So our mutual aid calls, and so I don't separate them out, though I have it takes just a little bit more manual work. When we do runs by municipalities, so down there, so the city of Madison, I don't want to say we don't mutual aid into the city of Madison, it's rare. So 2 different terms to use here. One of those is called mutual aid, one of those we'll call it auto ALS. So mutual aiding into another district, truly the term mutual aid means is that a district is out of ambulances, and we are going in there to provide an ambulance. We also do what are called intercepts, or auto ALS. An intercept means a service of a lower provider level. So the example will be Belleville. Belleville is an advanced EMT service. So if the patient needs more care than the AEMTs and Belleville can provide, or they feel that patient needs a higher level of care, then they will call, I would like a paramedic ambulance. The comm center figures out what's the closest one to send. Vast majority of the time it's us. We will go meet them either at that scene or somewhere during that transport time. We hop in and we take over care of that patient and they transport it. The third option there is 2008. I think we started, or agencies in Dane County started what's called closest ALS or borderless ALS in the interest of patient care. So when we were on the old King James Court station, the old Fitchburg Fire Station number 2, right? If you go over the hill just by Target, just down the other side of the hill, Manchester, I think is a road over there. That's the city of Madison. So there was a paramedic ambulance at King James Way. You had your cardiac arrest on the other side of that hill there. Back before borderless ALS, you were waiting for a city of Madison ambulance to respond, even though half a mile away was a Fitch-Rona ambulance. Right? So best interest of care now, almost 20 years ago, we signed an agreement that said like for like services. So we run a 2 paramedic ambulance service, they run a 2 paramedic ambulance service. So now, regardless of, the reason being it's been essentially taxes, right? Your taxes pay for that ambulance service. Thought that's kind of a silly way to run medical care, right? So approach this, and based on the questions and based on what you say with the 911 center, you will get the closest ambulance, right? So after we sign that contract, now we would go over that hill. So that's why you see all those calls into the city of Madison, the vast majority of those calls into the city of Madison, because there are parts of the city of Madison where we are closer to, right, over the hill there. Or if Station 7 on McKenna Road is out, anywhere off of Raymond Road or north up there, we are closer to that. If our crews, I mentioned, right, you happen to leave Meritor, you're 2 blocks away from Meritor and somebody has a cardiac arrest a block off of Park Street and we're driving by, it's going to call us and send us there. So as you talk about the give and take, we are still giving more than we are taking. I should take that. of all of our municipalities, we are giving more than we are taking. In our partnership with the City of Madison, we get the City of Madison a lot more than we go into their territory. It's not a horrible disparity, but it is a little bit different. Kind of just raise more questions, probably.
A couple of years ago, a friend of mine from the City of Madison was at my house in the town of Verona, and he had a medical problem. He collapsed, and we had to call the ambulance. And they came out and did a great job and took him into a hospital. Is that a City of Madison call because he's a City of Madison resident, or is that a town of Verona call?
If he was at your home, it first starts off of your address. So actually, we are paged to that first. I've talked in the past about a pre-alert. So before the 911 center even knows what's going on, it creates a call. So in the town of Verona, again, kind of based on where you're at, is probably going to get the Verona truck. It might get the one in Fitchburg that's got the straight shot out PD every once in a while.
I just meant on your statistics, like when we're looking at which communities are having how many calls.
If you would have gotten a City of Madison truck, I don't put that number in there because we weren't behind the scenes, right? Behind the chief's report, I have about 8 more tabs. I do keep track of the number of times the city comes in, but I don't count closest to ALS in this case.
Well, the question is like Fitch-Rona responded to the town of Verona.
Yep.
So in our statistics about the response, who's getting more responses, that's considered a town of Verona ambulance call?
Yes.
Even though it was for a City of Madison resident?
Yeah, it's based on address.
Yeah, it's based on the address, in other words.
Correct.
Yeah. If I'm visiting Pat Lytle in the City of Verona and you come to save me, that's a City of Verona call. Yes. Okay.
Correct. Otherwise, I'd love to put pins all over the world of the patients whose lives we touch.
Well, I mean, it's just like you're talking about with the ALS responses. It's very interconnected, and so these calls are to residences, but that's not necessarily who you're helping. Is that citizen? That could be a citizen from, wherever.
Absolutely.
Yeah.
When we talk about, so when I make the statements and I talk about our residents, I also like to talk about our residents and the businesses and all the employees who work for those residents, because all those businesses, they don't necessarily work in our district, but they don't live in our district, but they work in our district. So we take care of them as well as even if they didn't live here.
I had a friend live in Madison who Fitch-Rona went on mutual aid and picked him up. He got a bill from Fitch-Rona as a non-resident, even though he was in Madison.
Yeah.
So, yeah.
Right. If we go to Mount Horeb and do a service call, we don't bill Mount Horeb, the community, for money, do we? Or we just bill the individual?
It depends.
It depends, okay. Yeah.
It depends. If the patient has private insurance, and this has to just do with insurance billing. If the patient has private insurance, both us and Mount Horeb will bill them. Medicare does not allow that. So if the patient actually has Medicare, we will bill Mount Horeb. Mount Horeb will bill the patient's insurance. We don't take the whole thing. This was when the whole ALS agreement was set up, right? The goal was not to take all of the money away from the home service. So there's actually an agreement that's, and I would have to go look it up, but it's actually a percentage of all of the paramedic providers to the lower level of service provider. We take a percentage of anything that they get. So that because we hop in the back of Mount Horeb's ambulance, right? So Mount Horeb actually bills the patient for that base rate and mileage. We can't bill for mileage. They didn't ride in our ambulance. So there's actually a ALS agreement that is set up to standardize that for all the paramedic providers in the county. The goal was, I don't want to say there officially was a time because I can't speak of it for knowns. What the county didn't want is people to paramedic shop. As in, Fitch-Rona takes 60% of my call, and Middleton only takes 40% of my call. So I'm going to call for a Middleton paramedic, not a Fitch-Rona paramedic ambulance. So we've standardized it so that everybody should be charging the same amount. So you are just supposed to say, I need a paramedic ambulance. You will get the closest one. Good question. Yeah, Deb.
With that, I had 2 questions too. So when you say you had 34 calls of mutual aid, are the calls based on urgency of care, like you said? So if an ambulance is closer and someone...
In this case, no.
Okay.
So these are separated out. When I talked about closest ALS, I do not include that because we would have never gotten those calls. They would always get that. We had ambulances available, somebody else was closer. These are truly times when we were out of ambulances and somebody else had to come in.
Okay. And then another one, when you take a patient to a local hospital or to the emergency room, is it based on the closest hospital, or can they request where they'd like to go based on their insurance coverage?
So we always ask patients where they want to go. If they don't have a preference, if we don't know, we will take them either to the closest one or to the most appropriate one, which in this case is usually UW is the trauma center and the burn center, the pediatric center. If there's a patient who's pregnant, UW said, UW doesn't deal with pregnancy, right? Please go somewhere else to a more appropriate care. With that being said, part of the Medicare guidelines are we are supposed to transport to the closest facility, but there is actually a radius with that. All 3 Madison hospitals are within that radius. So just because a patient, right, says I doctor at UW, and we have to drive by St. Mary's, we have to drive by Meriter to get to UW, and they're a Medicare patient, Medicare does allow that because of their distance apart. It's considered the closest emergency hospital. But in majority of the time, it is patient's preference.
Thank you.
Yeah. All right, I'll keep moving. So where's Fitch-Rona going? You've seen this slide for the handful a couple of years, right? I like to put those big benchmarks in there. 2001 is when we first started our full-time staffing, right? That was actually, that's Patrick's box right there, right? That's when I started here as part of that crew that brought us from a volunteer agency to a full-time paramedic staffed ambulance. It was very shortly after that, right? Realized we had a number of calls. We were getting much busier. In 2003, added that second ambulance on here full-time within that very short period of time. Managed a lot of our calls until 2019 when we, again, got that big jump, realized we knew we were getting that town of Madison area, added 400 calls in there over the course of a year, so added that third ambulance in 2019. So what are our next benchmarks, right? So in the next handful of years, we're going to need a fourth ambulance, right? What that looks like, I don't know. Again, I would propose that would be a part-time ambulance, whether that be a peak time ambulance, but sometime in the next couple of years, we're going to need that as we just continue to see the growth of our senior living complexes, the medical care, the outpatient rehab center that was built here in Fitchburg, which is now expanding again, right? Great things, but things we need to continue to think about as far as that EMS world that we need to support. If that trend continues, the line you see there, that is a 3% line. Right? That's not the 5% that we're seeing. So looking 2030, which is not that many years out, right, we're going to be up to that 6,000 call volume. Right? That's potentially looking at that fourth ambulance becoming full-time and potentially a fifth ambulance. So giving you as the municipal representatives, what does that future look like? That's what that future looks like. All 3 municipalities just continue to grow, especially as we build the potential for the UW, the UW clinic and the St. Mary's clinic out in the city of Verona, right? Those don't generate a lot of calls, but they generate calls. Other growth, right? We've talked about the deputy chief position in the past. We tried to do a hiring process this spring. It didn't pan out for us. We just posted that position again. It closed last week. So we have 5 applicants in that process that we're working through here to hope to getting that second deputy chief on there starting the beginning of next year. Their focus will primarily be on training and operations. It's not things we are not doing now. It's just hopefully it will take us to that next level between myself and Jeff. We're just at capacity for operations, right? But to continue to just move forward and be the best we can make sure that we're being, we need that additional position in there. The other stuff you'll see is in there, right? Ideally, 26 or 27, adding that fourth ambulance. 3 years later, adding it to full-time. 2032, adding a fifth ambulance in there. tooting our horn for what we've been doing for the last couple of years. This year, Epic has provided us with a grant. Last year, we purchased point-of-care ultrasound. It's called POCUS. If you go to our website and you look under Talking Fitchburg, they actually did a really good segment on us doing this training. So we are the only ones in Dane County using point-of-care ultrasound at this point. There's about a dozen agencies in the state using ultrasound. A little bit of restrictions with that based at the state level. We're very limited in the scope of practice or what we can use it for. Currently, we can only use it to essentially verify the absence of heart activity. So when we do cardiac arrest resuscitations, what we might see on a cardiac monitor as we're doing compressions, it's potential that there is some heart muscle movement in there that we're just not seeing electrically or able to feel. We can grab that ultrasound and take actually a look at what the heart is doing. The future of this, right, as we become more comfortable with it and more proficient of it, is great in the pre-hospital environment. Again, looking at patients' heart contractility, right? So we can figure out whether is this a heart problem that will require one medication? Is this a blood pressure volume that can require another medication? So lots of places this can go. Moving on to essentially trauma assessments. Again, selling that need for that deputy chief of training to actually come on board and make sure that we're using this appropriately and making sure that our staff is proficient at it. For our Epic grant we got this year, for next year, moving on to it's called One Weight. It's a company out of Minnesota. It's fairly new, but it's actually integrated scales, patient scales, a medical grade scale that goes onto our cot. One of the things we continue to look at with our protocols, with our patient care, one of our challenges actually is pediatric patients and guessing weights. So almost all pediatric medications are administered by patient's weight. So Dr. Michael Kim, who's one of the group of, he's a pediatric ER physician through the UW system, has been pushing this for a handful of years now, and they actually did a study about how are we getting our patients' weight? Are we guessing? Are we asking parents? Are we actually weighing patients? How do we get that? Finding out that we suck, right? At one, we're really bad at guessing patients' weights. Probably depends on which parent you ask, right? What kind of weight you get in a child until they actually get there. So as you can see, right, that potentially makes a difference in how we administer medications to our pediatric population. A little bit more of a variance in our adult population, but we still have a number of medications we give to our adults that are weight-based. So we track that weight, but again, we are back to guessing weights on most of our patients. So the potential, and I don't want to say dangerously underdose or overdose because we've got a range to work with, but there's the potential, something as easy as pain medications, that we're guessing at patients' weights and giving them pain medications when really we're guessing wrong and we're way underdosing, say, on pain medicines. This is now going to give us an opportunity to actually take that, match it with the protocol, get accurate weights on patients, and do a much better job of ensuring patient safety about under and overdosing patients. Where can we go from here? Right, I always there's a wish list on my dry erase board in my office, right? What happens if somebody was going to give me a whole big bucket of money? What can I spend it on? Point of care lab testing, right? Actually, from the patient bedside, we can run heart tests, draw cardiac enzymes, and lots of other stuff. Now, our transport times aren't huge, but potentially, if I'm down in the bottom corner of our district, I've got about a 20-minute transport from the very south side of the town of Verona. Got 5-minute transport from the upper side of Fitchburg here. But that 20 minutes, or I'm going down to Belleville, the town of Vermont, the town of Perry. I think we've actually been out to Barneville a couple times this year. That's some pretty significant transport times, all right? So there's the potential here to do some point-of-care lab testing on patients that are 20 minutes, 30 minutes from a hospital and calling those lab results in and saying, right, we can confirm that this is a cardiac event based on not just ultrasound, not EKGs that we're transmitting, but here's some cardiac enzymes, right? It still hasn't really made its way to a great pre-hospital environment based on some refrigeration issues and cost, but it's getting a lot closer. Safety things, right? We can mount oxygen cylinder lifts so our staff doesn't have to lift oxygen cylinders into an ambulance. Still coming off of COVID and upper respiratory infections, making sure that our staff are appropriately fitted for personal protective equipment. Airway management is always in the forefront of one of the skills that we do, and make sure that it's your airway is something that really, it needs to be done well. They make some significant, some very realistic airway heads out there. And then the technology of e-bikes. We have 4 bikes that we use. The first 2 were donated by Epic. We've since gotten a larger one and a smaller one, as we've gotten staff who are taller and shorter. So we have 4 bikes that we use out at Epic. We use out at the Alliant Energy Center. We will follow race routes around. We were just out at the Sugar River Elementary School PTO fun run this weekend with our bikes. They just followed the staff around. So the potential to upgrade those to e-bikes is out there. So the wish list of what things we can do in the future. Any questions up to this point? It's kind of the state of the state. All right, I'll just do a down and dirty quick then of the budget process, of which you have seen has been submitted to all the municipalities. I've talked about this, right? We've got 2 processes. One is our capital improvement project, and the other one is our operational budget. As I mentioned, we have 5 ambulances. Roughly the cost of purchasing an ambulance fully stocked is about $415,000. Current delivery time on those is about 3 years. So I actually just spec'd out an ambulance that we'll be looking at to purchase in 2027. So that we are in the queue for that now. We're going to see it in 3 years. What will that do? So our historical replacement project process has been, we keep an ambulance for 10 years. It lives as a frontline ambulance for 6. It goes into that reserve status for another 4. By extending our fleet, right, as I know we're going to need additional staffing in the next couple of years, there are times we are in both backup ambulances, right? We've just had kind of a major fuel faux pas thing that's now they're replacing the entire fuel system in one of our ambulances. That's out for a week, right? In addition to, right, timing as well, we had the one at the Alliant Energy Center for a week, right, and we're out. So we've got a fleet. So we should have replaced one in 2023. We should have replaced, so the next one would have been replaced in 2025 because that time is 3 years out. Right? I bought 2 last time. So we didn't get our one in 2023. So we're going to get our 2023 in 2024, and we're going to get our 2025 one about a month early. So those are still scheduled to be here in December. It will replace one of them, and we will keep one of them, expanding our fleet to 6. So that'll change that to 8 years as a frontline ambulance, 4 years as a backup ambulance, with 6. Now we will still only, for the time being, staff 3 of those 6, but knowing that, again, that delivery time is 3 years out, when we are ready to commit that next ambulance into service, and hopefully before the next 3 years are up, we will have that ambulance to be able to do it and still be able to maintain those 2 backups. The county does actually own an ambulance that it essentially loans out to anybody who's short ambulances. It has become more and more, it's been used more and more for surrounding services. There are, I believe it's 26 ambulance agencies in the state of in Dane County with 1 backup. So one of our encouragements with the county has been to potentially look at getting a second backup ambulance. We frequently, because we are fortunate, if that ambulance is out, we are usually the next call from service providers. Can I borrow your ambulance for a day or 2? Well, they just need some maintenance. So part of that capital improvement projects, I believe all 3 municipalities are working off of a fleet replacement policy and just put some funds away every year to keep that pot there and prevent those spikes with the CIP. Other part of vehicles we own is those 2 response vehicles. Our oldest one is a 2010 Ford Explorer. Originally, we had them on a 10-year replacement. We put about 4,000 to 5,000 miles on them. I can tell it's exactly, was it 9 miles between the 2 stations? So right, on my UPS run every day. That's where the vast majority of those those miles get put on. So the next replacement, right, will be in 2030 for that Ford, the Expedition that I have down in Verona, and then we have the other one up there. So that's part of that vehicle replacement process. The overall budget itself, we talked about transport versus no transport, $1462.79 for resident, roughly about $100 more for a non-resident. The approach for that is the residents pay taxes, right, to help kind of subsidize their cost. So they get a price break because some of their taxes go towards the ambulance service. $150 no transport fee, right? If we come and we do an assessment, right, we've determined that you're fine, you agree you're fine, we leave you there, maybe provide some bandages, there is a fee for that. When we go, we don't provide an assessment, i.e. somebody just fell out of bed, right? So somebody fell out of bed, we help pick them up, put them back in bed, we do not charge for that, unless it becomes a chronic issue, which so far we've been able to work through those. We don't charge for supplies anymore. Last year, we actually switched over to a new billing company who did some recommendations for us that said it's very difficult to itemize supplies. Many insurance companies don't pay for supplies. So that's when the base rates went up. We just kind of bundled up the average cost of supplies for all those calls. And the patient who we just pick up and put on the cot and drive them to the hospital, and then that patient who gets the works done, the cost evens out. Everybody absorbs that cost. $22.66 per loaded mile, and $135 an hour for a pair of medics or EMTs to go to a special event. Anticipating, right, though I saw we're projected to get 5,100 calls at the end of the year, I still only plan for a run income for a 3% increase based on the actual ending number for the previous year to try to not, right, shoot for the moon, and I'd rather be rather get more funding than we anticipated than be under. Other fees that we have, we did a website overhaul last year, the year before, to be more compliant with we are considered a local government, so these are up on our website as well. There are 2 other fees that are up there. We do have to publicly post our fees. There's a $35 non-sufficient funds fee, which is pretty rare for us to get, but it did happen shortly after we implemented it. And then there is a 3% credit card. Patients can pay by credit card, right? The state of Wisconsin says that we can charge that to the patient. Or who's ever using their credit card, right? Just the statement that you see when you go out to eat, it is not any more than the credit card company charges us. It's just the charge of the processing fee. So those are the only fees. As far as revenue goes, and I apologize, it's pretty small, or at least it's small, and I'm staring across the room here. Here's the historical data about the number of calls we've had, and then based on that projected number, what we budget project, and then what we actually got at the end of the year. As you can see, right, it's largely a best guess, right? It's the nature of what we do for emergency calls. There are years we are over, there are years we are under. So what I do is take that 5-year average, the reimbursement per call of those 5-year averages, $417 per call. Again, that is per call. So that number you saw there that I said, right, that is not necessarily all patient contacts. That's Jeff and his horse rescue. Sorry, I just like to bring it up, right? So Jeff and his horse rescue in the big picture, we figure it was $417. The cardiac arrest that happens down the road, right, is also $417. So that is how I end up doing a really best guess for what we're going to get for run revenue. 2 other sources we have for revenue is all those unassigned funds, that reserve fund, as well as the interest from our reserve fund, those CDs, that interest is actually put back into our operational budget, so it helps to offset the cost for the municipalities. It's been significantly higher the last year or so. That is another source of funding. The post-retirement healthcare fund interest, that actually feeds back into itself. So that actually just keeps that fund growing as opposed to our reserve funding, which goes back into our operational budget. And then our contracted events, our stuff at the Alliant Energy Center, supporting the EPICS, UGM, all of those, we charge for all those events. We charge about it's a little bit more than what it would cover us as far as payroll. The goal is not to make money on those, it's to cover the cost. So it's tiny, lots of line items. This is actually all in your municipal budget folders. The other expenses we have, we break them down into essentially personnel costs and operational costs. Here's our personnel cost based on wages. Wages and benefits went up about 3.8%. This presentation should have gotten sent out in your packet as well. If not, it is on our website under the attachments if you want to go back and look at it. As far as operational costs, you'll see the big things, the little things in there, the bottom line of adding to our reserve funding. I'll circle back to that in a minute. Big things that we see, cost of fuel although this year the fuel cost went down. Though we are having more calls, we are putting on more miles. We actually do take the actual number of miles that we put on the year before and base that off of cost of fuel to determine it actually went down a little bit. Replacement costs continues to just go up significantly. Medical supplies as well, right? The big things that we see. Big summary of those changes right here is the salary. So what we do is this 2.75% increase in salary based on the collective bargaining agreement, as well as any increase in longevity. We next month will start actually talking about adding stipends for field training officers. That is actually going to be more in line with what the City of Madison firefighters as well as the police officers get supplemental pay. We've been talking about it for years. Jeff and a small work group has actually done a phenomenal job of creating a very robust onboarding process. Again, asking those medics to do more work. So there's some requirements they will have to meet. Then when they are taking that opportunity to onboard students and new medics as well, there'll be a supplemental pay for that. And then there was an increase in the Wisconsin state retirement, right? Something we can't avoid, but we are part of that process. As well as increasing wages for our part-time paramedics and our EMS interns to stay competitive. Increase in health insurance, radio maintenance costs just continue to go up. Same thing with medical equipment, things I had talked about, as well as the legal fees, right? So we look back historically, again, this is my thank you to Michelle, does most of this work, goes back and looks at that historical expenditures, says where have we been for the last 3 years and what can we look forward to in the future. Putting all that together, this is where we end up. So the 2025 operational budget is about $4,172,577. Estimating about $1,945,790 in run income, plus that other things it gives us. If we take that away, that leaves $2,174,387 left for the municipalities to provide. That breakout down there is what we've tried to do. So 47% of our operating budget is actually covered with fees for service, which means the municipalities are then paying 52% of the operating budget to cover for Fitch-Rona. Breaking it down by municipality as of this snapshot in time, it's all based on equalized value. It's a whole nother conversation. So based on equalized value, this is what, at the end of the day, this is what the municipalities are being asked for. The overall budget was a 5.19% increase. And then it's based on equalized value. The reason for the 5.19%, why is that number so very specific, is this right here. And that's actually the state statute that says because we are a district, we are actually granted, the municipalities are granted a tax levy limit exemption for districts that they are part of. We are an EMS district. There's the state statute itself. What it says is if certain criteria are met, right? It says the total charges assessed by the joint municipal EMS district cannot exceed more than CPI plus 2%, which means the CPI was published at 3.1%, which means if we get our budget up to 5.1%, we meet the criteria. So what that says is as the increase in the specific amount levied to pay for such charges, you can exempt that from your tax levy limits, right? Which just means that, so what the increase in Fitch-Rona's funding, you can't, right? How do I explain it? It can't be used for other departments, but it actually allows other departments more funding because you get to use it elsewhere and not towards EMS. Right? Biggest advantage, honestly. The biggest advantage of the EMS district is you have a phenomenal EMS district. Right? This is just another advantage for as far as funding goes. Other criteria in there, all municipalities must adopt a resolution. You have to adopt the resolution that says you agree to do it. You don't have to do it. And I believe that is in process. It's been done for the last 2 years. It's in the process again this year. So that is where that little extra line went to help go to add money to Fitch-Rona's reserve funding. The 2023 audit said our unassigned balance or our current reserve at the end of last year, $958,648, was at 23% of our 2025 proposed budget. The intergovernmental agreement requires a 15 to 25% reserve in Fitch-Rona, so we are almost there. We're still not at the 25%. So by putting that extra funding in this year, that'll bring us at or over that 25%. As well as by putting that in there and funding our reserve funding, it sets next year's budget up at a higher amount, so to absorb any future growth. As we look at adding those additional people in the next budget cycles, some of that tax levy limit exemption that you're putting in now can be used in the future to help offset that increase. The line number 3 on there says, so if next year we come back to the annual meeting and we're at 27%, 28%, there is language in the intergovernmental agreement that says the commission, it's not that Patrick goes to buy a Fitch-Rona response boat or something like that. What it does say is the commission members up there have one of 3 options. One, that money can be returned to the municipalities, which most finance directors say, stop screwing up my books, don't do that, but it's an option. The second option is actually to take that money and apply it towards future budgets, which then you can't use this because you bring that number down. The third option is actually to apply it to an assigned fund, such as the post-retirement healthcare or future ambulance purchases. So again, it's the board that is up here can define where that funding needs to go. It's not a gift to Patrick. That is the state of the state. That is what that 2025 budget specifically that was presented to you as a municipality covers. Any questions for me? Sit back.
Any questions for the chief about his report or the budget presentation? Well done. Sorry.
Quick question. Town of Verona's apportionment of the budget went up the most, I think, of the 3 municipalities. Is that because our valuation went up so much, or?
The valuation is really tied together. I think even like 2 years ago, they all just feed off of each other. So even if you didn't go up a lot, but somebody else went up a lot, you can see back to that slide there. So Fitchburg last year was at 56%, and I think they're 56% again this year. Last year, Verona was, I think the percentage is on there. Last year, Verona was at 34%, and they're at 38%. They're all tied together. If one municipality goes up or down more than another one, it just kind of creates a ripple effect with, even though your overall equalized value only went up, it's on there somewhere, between last year. So you were 92,000 last year and you're 98,000 this year. So it's not that significant of a difference, but proportionally between the 3 municipalities, I'm not explaining it right. You were at 4.7% last year of all the equalized values, and this year you're at 5.1%. So even that 0.4% was just different than the other municipalities. Am I totally just stumbling over my words there? Yes.
I don't get it. Okay.
It's all based essentially. It's proportional. It's proportional how all of them go up. So if one goes up higher than the other one, it's the trickle down of yours might have been a little bit or more, but it was just a little bit or more than somebody else. That was a horrible explanation of how that works.
All right.
Any other questions I can't answer?
Yeah, any other questions the chief can't answer? Anyone? Bueller? All right. Oops, go for it. Yes, please.
I'm curious, how many calls do you have when you're not charging a fee?
Off of the top of my head, we only charge about, so of those 4,000 calls, we only generate bills for about 65% of them. So there's about 30% of our calls that never generate a bill. Breaking it down further from that, I would have to go back and dig a little bit deeper because, right, as I mentioned, right, some of those are a fire standby. But some of those could be picking up somebody and putting them back in bed. So, but it is roughly, it's at least even for me, every time I see that number, it's much larger than I would ever think it would be. But yeah, about 30 to 40% of our calls we don't bill for. It's also part of, I guess I take the approach as well. It's part of our public service. We are a tax-funded department, so part of our job is to go help people and pick them up and put them back in bed or rescue their horse from a farm. Just a unique call to share.
The horse didn't have insurance, by the way.
Any other questions? Moving on to, is there any other business that we need to cover? Seeing none. Oh, go for it.
Take the opportunity on behalf of the town of Verona residents to thank Chief and Deputy Chief and your staff for the service you provide to the town of Verona. In my 10 years as being town chair, I have not received a single concern or complaint about the service that you provide. And I'd also just like to say thanks to the entire commission for your commitment and once a month getting together. It's kind of a thankless commitment, but we certainly appreciate everything the commission does. And I thought it was a great presentation, Jack.
Thank you. Any other comments? Yeah. Do we have a motion to adjourn? Do we have a second? I need somebody from a second from the city of Fitchburg. All in favor signify by saying aye.
Aye.
Anyone opposed? All right, the meeting is adjourned. Well done.
Thank you.